Welcome to this webinar on Prevention Plus Wellness Resources. This is a free webinar hosted by Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. And this session will last, I said an hour, but really I think it's going to be quite a bit shorter than that because I think it's best if I show you these resources and then send you a PDF of the slides and then let you explore the resources you're most interested in. So I'm going to walk you through the slides. I'll show you the resources that we have on our website, preventionpluswellness.com. And then then you'll be able to explore whatever you want. So whoever is registered today, by the way, we have a full sold out session. So thank you for that. We've got people from throughout the country and abroad visiting us for today's session. That's awesome. Thank you all for taking time from on your Fridays to be with us. And I'm hopeful that we'll be providing you with some tools, some resources that you'll be able to use with your youth, your young adults in your region to make a difference in their lives, protecting and promoting their lifestyle. My name is Dr. Chudley Wirch, and I'm president and founder at Prevention Plus Wellness, and again, coming to you from beautiful St. Augustine, Florida. Let's take a look at today's webinar objectives. Number one, you will be able to describe the free resources that we provide at preventionpluswellness.com, both in terms of prevention of substance use, as well as promoting wellness behaviors for youth and for young adults. In addition, we'll be exploring Prevention Plus Wellness, or PPW, program and training offerings, and very briefly give you an overview of the steps for implementing these unique Prevention Plus Wellness programs. Thirdly, we're going to identify PPW purchasing resources and how you can get free webinars, program samples, and news from this point on. So we'll be covering all that and probably a little bit more in today's session. Remember, everybody who's registered today, I will be sending you an email before the end of the day. And with that email will be a certificate for 1 hour CEU credit for the time you spent with us today. I'll also send you a link to, well, I'll send you a PDF of the slides today, so it'll make it very easy for you to just look at the slides and click on the links and go to those resources you're most interested in. And we're also recording today's session, so I'll send you a link to the recorded session. You're welcome to share the slides and the recorded webinar with as widely as you like with as many of your friends and colleagues within your region, your state, your nation. Please do share it and give other people the good news about our unique role in this prevention field, which is to integrate prevention of substance use and other risk behaviors with the promotion of wellness lifestyles and positive identities of young people. So before we go any further with the slides, I'd like to pull up a poll, launch a poll to learn a little bit more about who's attending today's webinar. So in just a moment, you're going to be seeing three questions, three very brief questions, multiple answers. You can answer more than once on each of these questions. When you see them, answer, please, if you don't mind, so we could see what you're thinking of and what you're interested in. Maybe we could tailor this training a little bit toward your interest. The first question is, which prevention program topics are you most interested in? And again, you can answer more than one answer there. Number two, what age groups are you most interested in when providing prevention programs? And then lastly, number three, and you'll need to scroll down to see all these three questions. What types of prevention resources are you most interested in? What types of resources? And notice the last item is others. So if you have some others, I don't know what that would be. After completing the screening survey, if you are interested in resources other than those listed, I'd love you to send me your answers, your responses in the live chat. So Let me just give everyone just a couple more minutes to fill this out. We've got about 2 out of 3 people have completed this who are online with us. Love to get that up to at least 3 out of 4. So do take a moment. This way we'll be able to see what your interests are, what your preferences are, and your voice will be heard in this poll. It's like voting. Make sure you do vote. If you're in the US, make sure you vote in November. It's like voting. Your vote makes a difference here at PPW. All right, 2 out of 3, I should say 3 out of 4 have answered, have responded, and we're just 1 percentage point away, 1 person away from 8 out of 10 of you completing this. So if we could just get 1 more person to answer these 3 simple questions, we will go over 8 out of 10 responding. We are over that. Thank you so much. We're at 82%. Thank you. Awesome, awesome. So I'm going to share these results with you. I just sent them out. It may take a moment to get to you, but I'll read them aloud and you could hear me. So which prevention program topics are you most interested in? Number 1, alcohol. Makes sense because alcohol is the most prevalent substance of use among young people. 6 out of 10 high school students have tried alcohol by the time they're in at that high school, older adolescent age. That's followed closely by e-cigarettes and marijuana, but also interested in opioids and wellness and fitness behaviors. That's fantastic because that's what we're talking about today, the prevention of substance use and the promotion of wellness and fitness behaviors, protective wellness and fitness behavior. We're talking about integrated interventions. We're talking about holistic interventions or programs that address a broader, the whole youth, or more of the whole youth, I should say. Question number 2, what age groups are you most interested in when providing prevention programs? The winner there, middle school, that's very common, but right behind that, high school, and quite a few of you young adults as well as elementary school. So yes, we have resources across all of those. And then lastly, and then we'll be providing those today for you. Lastly, question number 3, what types of prevention resources are you most interested in? By and large, webinars. Well, we've heard that, and that's why we do the best we can to provide 1 or more webinars per week for you. So we've been trying to do our best to up our game and make sure we provide webinars and content that's good for you and instructive and helpful for what you do. And thank you for what you do. God bless you for all of you who do prevention. I know you don't get paid the most. I know it's very much a struggle and challenge to do good prevention, evidence-based prevention, evidence-informed prevention, even more so now with COVID-19. But you are making a significant difference in the lives of youth and young adults and families in your communities, your regions where you live. So my hat's off to all of you. You're wonderful. And let me see, behind webinars, other things, online tools, I'll be showing you that. Programs, I'll be showing you that. Training, we'll talk a little bit about that. So a lot of resources. So thank you. If you did answer others, I'd love you to type in the live chat what you mean by others. But I'd love to find out what it is that you might need for a resource. Always looking to learn from you. All right, so we're back to the slides. Again, the topic at hand, prevention plus wellness resources. We went over these objectives. So let's go ahead and take a look at the free prevention plus wellness resources. These cost you nothing. So we're always trying to provide resources and tools, and we realize some of you have the resource, some of you have your own funding, some of you have you have grants, you have other sources of revenue, others of you don't. And so that's why we do want to help out every way we can, and we do provide free resources for those of you that may not have the funds at this particular time, and then maybe you do, and then you can purchase some of our things that do cost money. So let's take a look at what we have for free on our website, preventionpluswellness.com. If you've not been there, do go there and type in your email, and then you'll be on our email list for our webinars and our other resources. So number one, first of all, this is, I think, the most widely, or one of the most widely visited pages on our website. Healthy lifestyle guidelines for youth goal setting. So what we've got here on this website are guidelines for setting goals for youth. In other words, recommendations from major national, federal, international organizations for youth, and then for young adults/adults with regard to these four critical health areas: physical activity, healthy nutrition, getting adequate sleep, and controlling stress. We have these resources, these recommendations from these organizations for youth and then for young adults/adults. So for example, under the heading of youth physical activity, the resource that we have shown is the Centers for Disease Control. We give you the link for more information, and the recommendation from CDC for youth throughout the nation is 1 hour of physical activity 7 days a week. That's the minimum recommendation from CDC. That includes a combination of different types of physical activity: aerobic, muscle strengthening, bone strengthening, and you could learn more at this site, on this page, on this webpage on our website, preventionpluswellness.com. But to make it easy for you, at the bottom of this slide, as you can see, there is the link. So when I send this to you at the end of today, this PDF of these slides, you'll be able to pull it up and click on that link, or you could just go to our website, preventionpluswellness.com, and look under the heading of tools. That's TOOLS, and you'll find most of our free resources. So just a reminder, if you don't receive an email from us today, please check your spam folder, because you've got a couple of attachments, your certificate for completion, this PDF of these slides. Because of that, it's likely that some of you have a filter that will send my email to your spam folder. So at the end of today, if you haven't received it, do check your spam folder, and that's where you'll find it. Let's take a look at another free resource. This has this page here, which is called Prevention Plus Wellness Youth and Teacher Resources, I think has the most content for those of you who want free resources. So what you're going to find on this page are evidence-informed health behavior content and tools for professionals, for parents, and you're also going to have tools for youth, which includes youth behavior messages, videos, slides, and other types of resources. There'll also be an assignment, a youth assignment, sample assignments. So you could use these for your youth to be completed in class or outside of class, in a classroom or in home setting. And now the topics are physical activity. By the way, the topics are all the topics that we cover at Prevention Plus Wellness. Physical activity, healthy nutrition, sleep, stress control, goal setting, spirituality, as well as marijuana and e-cigarettes. We focus on those two risk behaviors only because they're the ones that are the new epidemics, and there seems to be more myth and misconception and lack of understanding about those. So those are all the topics. So essentially what you've got on this page, and there's a lot of information on this page, is you've got resources for youth that are designed for youth, and these are evidence-informed. These are highly respected sources of information like NIDA, for example, National Institute on Drug Abuse, or CDC, the Centers for Disease Control, Prevention, et cetera. So you've got really good, trusted, science-based resources, and they're for youth, they're designed for youth, and you will have a description, you'll have a link to go to those resources, and you'll have a sample assignment so that you can bring that content back into the youth. So those assignments are designed to have youth reflect on their own habits, whether it's physical activity, nutrition, breakfast, sleep, stress control, goal setting, spirituality, or marijuana or e-cigarettes. Good content for youth. And then right after that, there's going to be content in each of those areas for you, the prevention and health specialist / parents. So feel free to share these materials with parents, with teachers, with coaches, and to use them any way you like. If you come across a resource that for whatever reason is no longer there, and these are web-based resources, so they come and go. If you see one that's shut down, the site's closed, send me an email, let me know, inform me at info@preventionpluswellness.com. I would greatly appreciate it, knowing that, and we'll clear it off. If you have a resource that you would like to add to this youth and teacher resource list, again, as long as it fits within those topical areas of physical activity, nutrition, sleep, stress control, goal setting, spirituality, cannabis, or e-cigarettes, we would love to take a look at it. We may add it to the list. It's got to be an evidence-informed, highly reputable source, and then we'll take it from there. We'll go ahead and add a description. We'll add if it's for youth, we'll add an exercise or an assignment. So please do. This is your page. Think of it as your page of free resources for youth, for teachers, and for you and for parents. So this page here, free, has I think the most of our resources. Let's see what else we have. We have a relatively new COVID-19 PPW, that's Prevention Plus Wellness Program Resources page. So on this page, this is what you'll find. You will find the Prevention Plus Wellness Program remote online protocols. Protocols to implement the programs that we provide, and even if you don't provide them, these protocols might be useful for you. Protocols to implement our programs to one person, to one youth at a time online, to two or more, in other words, a group of youth online live, by video, and by telephone. So there's really 4 protocols. Providing our programs, Prevention Plus Wellness programs to youth online, individually live, in a group live, by video, and by telephone. So those protocols are there for you. Number 2, you will also see a free recorded, and by the way, we redo this every couple of weeks or so, a free webinar called Implementing Substance Use Prevention Plus Wellness Programs Online Strategies. So you'll find that. That's a recording of about an hour in length. You're welcome to listen to that. Number 3, we also have the slides, the training slides or the webinar slides, which you can go through very quickly. Number 4, we provide an online goal contract, and 5 and 6, online pre-test and post-tests. So these are designed for when you provide your Prevention Plus Wellness programs online. If you can't provide them in person to one youth or to a group of youth, and you decide to implement them online, you have tools to ensure that you can do that. And these tools include a pre and post test link so that you could assess your lesson online, and an online goal setting. So all those are discussed in more detail in our program implementer training. But do go ahead. You'll find links to all of these things on this page. And at the very bottom of this slide, that page, that will take you to the COVID-19 PPW resources. Just like the slide before, this will take you to the bottom link, at the bottom of this page. That link will take you to the youth and teacher resources. So far you've got healthy lifestyle guidelines for youth goal setting, you've got youth teacher resources, you've got COVID-19 resources. All these things are free. And we also have free tools to promote your prevention program. Obviously, we developed them for those who are using Prevention Plus Wellness programs to promote their programs, but I think some of these resources you can use to promote even if you're using some other prevention or wellness program. So one thing we have, there's 4 things here. We have a PPW, that's Prevention Plus Wellness Programs fact sheet. 1 page in length, very, very practical for distributing so that you can learn more about PPW programs and you can help other people learn more. We also have these beautiful colored brochures, 2-sided, 3-panel brochures. And for all of our major programs, we have a brochure. We're actually completing the last brochure as the Racial Justice Prevention Plus Wellness program. That's our newest program. Very, very different from our other programs, but very unique, very powerful. And we're just creating that brochure as we speak right now. It'll be done in another day or so. So we have brochures for our other main programs. Sport Prevention Plus Wellness, that's our youth program, high school, middle school, elementary schools. That's evidence-based, in shape evidence-based for young adults. And you can see the others, Sport 2, vaping, marijuana, In God's Image, opioid. Those are our programs, and we have brochures for all of them so that you could read about them and you could make copies of those brochures and share them. We also have, number 3, a whole bunch of banners and posters. Banners and posters, it is Friday. And these banners and posters, you're welcome to make copies of them. What they include are very positive images of young people, like to the right, the image to the right. Very positive, happy, healthy young people engaged in wellness behaviors with usually a short tagline. And so you could take these, you can make copies, hard copies of them, you can put them on your website any way you want to use them. These materials are for you to use. And then we even have a logo, Prevention Plus Wellness Lifestyle, which you're welcome to copy onto things for your youth as handouts, t-shirts, hats, wristbands, what have you. So that's, all of these materials are for you to promote your Prevention Plus Wellness programs and awareness about PPW programs, or just about prevention in general. We also have, this is a more recent tool we created because we heard from a lot of prevention providers who don't have access yet or have to regain access, especially now. I think with COVID, things have changed. You may have had a relationship, you may have had permission to go into a school, a Boys and Girls Club, a YMCA, whatever the case might be, and provide your prevention programs. COVID may have changed that. This is a tool to help you get permission from that decision maker, that administrator at an organization, so that you can provide your Prevention Plus Wellness or prevention program to the youth. So the first part of this, by the way, it's called a PPW program menu. It's a survey, about a survey or a menu, a page and a half. Of course, there's a description of Prevention Plus Wellness, evidence-based, evidence-informed substance use prevention programs that promote wellness, lifestyles, positive identities. But this menu includes or focuses on 4 things. So you could sit down with your administrator, you can give this to your administrator of your school, of your Boys and Girls Club, what have you, and then they can go down the list and they could say, yes, I like, under number 1, I like these program implementation options are acceptable to me in our setting. Number 2, these health behavior goals, whether they're wellness goals or substance use prevention goals, yes, these goals are important to prevent, to reduce obesity, to increase physical activity and healthy eating, to increase sleep, to prevent opioids, to prevent cannabis, to prevent alcohol. So they'll be able to check those off. They'll also be able to check off number 3, PowerPoint tailoring ideas, how to promote the program. Once they get through this menu, they'll be more likely to allow you to have access to provide your Prevention Plus Wellness programs in that setting to their use. So that's why we created that. For those of you who don't have permission at this point to go into an organization and provide prevention and wellness programs to young people. We also have a sample grant proposal. So you can see all the components of the sample grant proposal. And again, like all these materials, the link is at the bottom of this page, so you can click on it and go to see that sample. There's a title of the proposal, which you can change. And this is just a template for you to take, cut and paste, and then do what you want with it, and maybe edit it, alter it, modify it to your setting, your interest, and submit it for funding to whatever agencies that are providing prevention funding in your region. So as evidence-based prevention plus wellness, obviously you can see it includes the description of the proposed project, program need, program benefits, implementation plans, the population served, financial breakdown, and how you'll track program success or evaluation. So that's a sample proposal, grant proposal. We also have on our website under tools, TOOLS, this page, which is a prevention plus wellness screening and brief intervention logic model. All prevention plus wellness programs are evidence-based practices, screening and brief intervention. So on this page, you're going to see two things. One, you'll see an actual logic model, PPW screening brief intervention logic model, and then you'll see a slide deck as well. So both of those are resources. These are helpful tools, especially when you're going for funding. Funding agencies often ask for logic models, and so here it is. We can present you with a logic model or how prevention plus wellness programs work. What are the inputs? What are the outputs? Now let's take a look at prevention plus wellness programs and training. So we're going to start with that, by the way, all of that, free materials. These now we're switching to our evidence-based and evidence-informed programs. There is a charge for these programs. I'll just give you the heads up. So first of all, evidence-based programs, two of them. One of them, sport, prevention plus wellness. This is not just about sport. This is a single session screening and brief intervention. It includes parent materials and it includes flexibility and resources to extend it beyond a single session if you want to. And it doesn't just address sports, it addresses alcohol and drugs, physical activity and sports, healthy breakfast and nutrition, sleep, and to a certain extent, stress control, particularly the high school version. Comes in high school, middle school, and elementary school versions. That's our sport evidence-based prevention plus wellness program. The second evidence-based program we provide is called InShape PPW, and that is also single session screening and brief intervention. So because it's a single session, it can be implemented in just about any busy setting. Even if schools are busy with COVID, you should be able to get in and get that single session evidence-based message to youth, to young adults with InShape PPW. Notice InShape PPW addresses alcohol and drugs, physical activity and sports, healthy breakfast and nutrition, sleep and stress control for young adults. These programs are being used throughout the country and abroad. InShape PPW is being used in college campuses and communities, in U.S. military. Sport is being implemented in just about any setting where there's young people. Recreation, sports, clubs, juvenile justice, homes, just again, certainly schools, after school, during school, PE, health education, everywhere. And so, in fact, sport is in all 50 states. So those are two evidence-based programs, sport and InShape. Now our evidence-informed programs. These are modifications to sport or InShape. Same screening, same evidence-based screening and brief intervention, evidence-based practices, screening and brief intervention format, same conceptual basis, positive images. It's called the behavior image model, but they haven't been evaluated. These programs haven't individually been evaluated. So we've got a vaping PPW program, high school, middle school, elementary school. This addresses e-cigarette use prevention, plus the wellness behaviors, physical activity, sports, nutrition, breakfast, sleep. Marijuana PPW, also one session, screening, brief intervention, high school, middle school, elementary school version. Opioid PPW, a little bit different because we've got versions for the high-risk groups identified by SAMHSA, the Substance Abuse Mental Health Services Administration. So we have an opioid PPW for adolescents, but we also have one for high-risk men and for high-risk young men and for high-risk young women. That's the opioid PPW program. Opioid PPW, a little bit different. than some of our other programs because it does address some of those things SAMHSA says is important, like medication-assisted treatment. Number 4, Sport 2 PPW is our only multi-session program. It's 6 sessions. We have a high school, middle school, elementary school version, whereas all of our other programs integrate the substance use, avoidance, prevention with the promotion of these wellness behaviors. Sport 2 pulls these behaviors apart and has separate sessions, separate content on each of the wellness behaviors. 3 lessons on different types of physical activity, moderate, vigorous aerobic, and muscle strengthening. 2 on nutrition, healthy eating, and weight control, and a 3rd on stress control. So Sport 2 is an evidence-informed program, 6 sessions. We also have In God's Image, which is our faith-based program, very unique program, where it integrates the prevention of substance use with the promotion of healthy habits and spiritual behavior. So it's great for a faith-based setting. And lastly, our brand new program, very unique, very different, and very much needed, Racial Justice Prevention Plus Wellness, 1 session screening brief intervention for youth, which promotes anti-racism behaviors. So what it does is it promotes anti-racism behaviors, contemplation, observation, learning, and then taking action. And it addresses the avoidance of racism, discrimination. Why? Why are we at Prevention Plus Wellness addressing racial justice or anti-racism? Because racial discrimination is a social and environmental factor that increases the likelihood of substance use and negative health outcomes, again, among adolescents as well as adults. And you can go to CDC, Centers for Disease Control and Prevention, just blog it or search for it and look up CDC racial anti-racism or racial discrimination. You'll see what I'm talking about. There's solid research showing that racial discrimination, in fact, there's just been a recent review of research showing that racial discrimination perceived by adolescents increases substance use, increases risky sexual behaviors, increases a number of negative other health outcomes. I'm trying to remember them, but really very much an influence, racial discrimination influences health outcomes for young people as well as adults. Those are our evidence-informed programs at Prevention Plus Wellness. What are the 3 easy steps for implementing our programs? Well, we've got an 8-minute video, so you don't have to spend much time, but you can click on that YouTube link, or you could just search for YouTube, and you'll be able to find Prevention Plus Wellness. Actually, I don't know the title of it. I really should, but you'll find it on our website, and there's the link there as well. And let me just describe it for you. So again, all PPW programs are screening and brief interventions. That means that they are evidence-based practices, and there's 3 parts to all Prevention Plus Wellness programs, 3 steps. Step 1, you screen youth for their current health habits so that you can increase their awareness of their health habits, not just substance use, but these other behaviors that are chronic disease risks. Sedentary lifestyle or screen time or obesity, not eating healthy foods, fruits and vegetables, not eating breakfast, not getting adequate sleep. But we assess them from the positive perspective, the wellness perspective. Are you getting physical activity? Are you eating breakfast? Are you getting 8 or more hours of sleep? All of that is a self-assessment, and that's step 1 of Prevention Plus Wellness program. Step number 2 is you provide feedback about each of those behaviors using your PowerPoint slides, using the scripts found in your Prevention Plus Wellness program. And it's designed to increase motivation among youth to change their behaviors. How does that happen? Positive images are provided, image terms that cue unconscious, desired future images of themselves and their peers being more active, fit, healthy. Those are associated with exercise, with sports, with healthy eating, with sleep. And that increases motivation for change. Those images of themselves, those desired images are values. And then you're going to capitalize on that with step number 3 by having youth complete multiple behavior goal setting and monitoring. That's to set goals to avoid substance use, whether it be alcohol, whether it be vaping, e-cigarettes, whether it be cannabis, whether it be opioids, depending on which PPW program you're using. And also increasing protective wellness behaviors. And this is the behavioral initiation and maintenance phase. This is the self-regulation skills, self-control skill. Young people lack self-regulation skills, particularly high-risk kids. This is the way to teach them those skills, to set and monitor goals and develop changing their own behavioral patterns so that they are healthier. We also have a number of training opportunities, and with COVID, of course, most of our training to date, at least more recently, since COVID, is online. We've got a 2-hour live online program implementer training for all of our programs. We have a 2-hour line train the trainer. So if you become trained as an implementer and you implement one of our programs once, you're eligible to take the 2-hour live online training of trainer program, and then you could train others to implement our programs, others in your organization or your region. We have a 1-hour online youth leadership training where we train youth in 1 hour and we give them PowerPoint slides to implement our programs to their same age or younger age peers. And we do have on-site training, program implementer, train the trainer, youth leadership training. It's just that with COVID, we're not doing much of that. Instead, most of the training that's done on site now is done by those who we've trained as trainers. So, and they are usually doing that training with smaller groups of professionals. So that's what we're seeing happening with the COVID, and probably that will be the case for some time at least, which is good. We're getting it done, online training, you know, for all of the complaints and sort of put downs for Zooming like we're doing today, you know, using online platforms. It's a blessing, let me tell you, because you're able to reach youth and your peers, your colleagues, you're able to get work done, you're able to motivate, you're able to support, you're able to connect. And so really, it's much better than nothing. And if you use these tools properly, they can be extremely effective. And there are advantages to using online instruction and training, even to face-to-face instruction and training. All right, let me see, where were we? Purchasing resources and getting free stuff. So let me show you the purchasing resources and free stuff. First of all, how to get free stuff from us. So we have news and blogs, and there's a link there. And we post things every week. So we've got new content, and it could be announcements about free webinars. It could be research. It could be whatever the case may be. So you could check our website, preventionpluswellness.com, every day, every week, every month. But something easier is you could sign up to get notices of free webinars and resources. And you could also request free redacted program samples. Any of our programs you want, sport, in shape, opioid PPW, vaping PPW, marijuana PPW, in God's image, sport 2, and racial justice PPW. You could ask for any of those samples and we'll email you a redacted sample to look at. But if you go to our website, preventionpluswellness.com, you put in your email address, you'll be on our email listing, and we send out weekly emails so that you'll be in the loop with regard to free webinars and other resources that we provide every week. As far as purchasing resources, several things here, 5 or 6 things to take a look at. We have a program and training order form. This is probably, it's actually a hard copy. It's a PDF. You can make a copy of it, download it, make a copy. It's a, like a page and a half, 2 pages, and you'll be able to see all of our programs, all of our training, and all of the costs. We also have number 2, an online catalog of our most common, our most popular materials. So it's online, and you'll be able to see very quickly, scan through all of our programs and training. Number 3, we have volume pricing and regional licenses are allowed. We want to, for those that have the funds, we like those kinds of purchases, because then those organizations, whether it be a state organization, a large a regional organization, whatever the case might be, if they purchase it, if you purchase in numbers, programs or training, we can give you price breaks, and then you can get those tools, those programs and those trainings out to those smaller organizations, far away, rural, wherever, in the city, wherever the case might be, but they'll be able to get the tools and provide these essential evidence-based, evidence-informed messages to youth, even though they might not have the money. So we do like to provide that number 3, volume pricing and regional licenses. Number 4, we have a program training schedule. You might be interested in that, for those of you interested in training as an implementer, training as a trainer, youth leadership training. And then lastly, number 5, we haven't had this recently because of COVID, but I think in the future, hopefully we'll pick back up with this. You could host a training in your region, and that organization that does the hosting gets free materials, gets free training. And then because they're doing the work, they're bringing people in, and essentially they should be rewarded for that. At least that's how we think of it. So let me just summarize what we've covered today. I got to move my toolbar out of the way first. So number 1, Prevention Plus Wellness offers a range of free resources. And these are designed to not just protect youth from substance use and other risk behaviors, but promote well-being. And that includes young people, from children, young adolescents, older adolescents, and young adults. These resources include online substance use and wellness resources for professionals, for youth, for parents. It also includes COVID-19 resources, so you can provide your PPW programs online during the pandemic, and more. And lastly, number 3, PPW provides a range of quick and easy to use to implement evidence-based screening and brief interventions, and convenient online training to prevent common risk behaviors and increase critical wellness behaviors among young people. That's what we offer at PreventionPlusWellness.com. We're all about integrating wellness with prevention. You can reach us at 904-472-5022 or info@PreventionPlusWellness.com, or go to PreventionPlusWellness.com, drop in your email, take you about a second, and then you'll be on our email list. And there it is, PreventionPlusWellness.com, where you'll be then informed through our emails about upcoming webinars and other resources. That's a screenshot of our homepage, PreventionPlusWellness.com. And I think I want to just say thank you for, again, joining us for today's session. Now we got 15 minutes, so we got a lot of time. I could stay here as long as you want, or we could wrap things up now, but I'm going to see if anybody has any questions or comments. You've got 2 places you can place those. There's a Q&A and there's a live chat. So I'm going to Q&A first, and I see, could you please send us that link so that we can be directly linked? So what I'll do is I will send you a PDF of the slides, and then you can click on any of those links, and you could register, or you could request information, or you could look at all these resources. So I think that should cover it for you. Or you could just Google right now as we're speaking, PreventionPlusWellness.com, and you'll see a little pop-up box, and you just put your email in. So thank you for asking that. I'm going to look at the live chat and see what kinds of questions or comments have been made. This is your time now, so if you want to ask questions for clarification, or if you want to share anything, what's working, what's not working, what are you struggling with, this is your time as a prevention and health specialist to share with your colleagues here. Thank you so much for the resources. Everything's good. That's great. I'll just wait another minute or so to see if anybody has any questions. Was there anything that wasn't clear? Do you need any other help? And again, feel free to say, hey, in our area, we're doing this, or this is working, or we're struggling with that. All of us are in the same boat again. And still, as I understand, as I continue to talk and train people throughout the country and abroad, still people in many places, things are changing day to day with regard to opening of schools and access to youth and what's going to happen in their organization, in their communities. So I know it's a really challenging time for you, but we're doing whatever we can to help you provide your programs in person, individually, in a group, online, live, video, by phone. If you need something else from us, please let us know, and we'll attempt to develop that for you. That's how we've created most of our other programs, because professionals like you said, hey, we could really use something in this area. We'd like a program that addresses vaping, e-cigarettes, marijuana, opioids. And from that, all of these other programs have been developed. So thank you for those of you that have pushed us and asked us to create things for you. And you have responded by using them. Let's see, thank you for everything. I use these resources with our coalition members. Awesome, that's what they're for. Use them, and thank you for using them. Thank you so much for your time and dedication helping us. My pleasure. It's a real honor for me to help you guys, the heroes, prevention heroes, which again, if it was up to me, I'd make sure you guys all get a raise and get more recognition for what you do. But that's not the way things work. And so whatever I can do to help and support you, let you guys toot your own horns. If I could toot your horn for you by sharing successes that you have in your communities, we'll put it on our website, we'll share it on our social media. Let me know how we can help you through training, through our programs, whatever the case may be. I'm gonna check one more time, Q&A, nothing else there. Check one more time, live chat. And see if there's anything else there. I think there's one more message that was added. Thank you for great. So that is it. I'm going to wrap it up. Thank you again for everything. God bless you for what you're doing. Have a wonderful afternoon and a great weekend. Stay safe. Take care of yourselves and your family. God bless you guys. Hopefully I'll see you sometime in the near future. Bye-bye.